Now, I mentioned earlier that we can, by virtue of the fact that blood contains ions such as sodium and potassium, which carry an electrical charge, we can, by measuring the resistance across certain parts of the body, estimate the change in the distribution of fluids within the body and in response to an orthostatic challenge. Here's a depiction, although somewhat distorted, of an individual, and what we measure is the volume and change in distribution of volume within the thorax or chest versus that which is in the splanchnic or the gut versus the upper leg and the lower leg. And these little dots here actually represent the way in which we do it. We put a little electrocardiogram stickers on these at these various locations. These are attached to wires which can measure the change in resistance in response to a challenge. This slide is from an older publication which shows the change in the percent blood volume when subjects are tilted. And here we can compare the control, the open boxes, to subjects with POTS. And as I said, this compares quite comparably to what we see in many subjects with chronic fatigue syndrome. This is somewhat of a simplification because our laboratory has used these sorts of measurements to subcategorize various populations of people, individuals with orthostatic challenge, who are rather orthostatically challenged. But this is a very interesting slide to show a generalized difference again between control and POTS, and this shows the relative change once a tilt is imposed. Now, what we find, and again, we're looking at the thorax, the splanchnic or gut versus the upper leg and the lower leg, and what we find is that two major changes occur. You see that in control, when a control subject is tilted, there's about a 10% decrease in the blood volume in the thorax, and there is about a 20% increase in the gut. And that makes sense that when somebody is tilted up, gravity pulls the fluid out of the chest and it starts moving downward. Take note, however, of the fact that, as shown in the cross-hatched lines, subjects with POTS show significantly greater emptying of their thorax and significantly increased pooling of fluids in the gut. Some of those changes, many of those changes rather, are controlled or regulated by blood vessels. So as I indicated earlier, one of the objectives of our studies is to understand how it is that the blood vessels control blood flow. And one of the methods that we employ, as I said earlier, is the use of skin as a surrogate tissue in which to measure nitric oxide. Nitric oxide is a regulator of many things in the body, and it's a very, very small molecule which is produced in many locations in the body and actually can cause a relaxation of blood vessels. This is a depiction of the laser Doppler flow that I mentioned earlier. We put it on the skin